The second thing is to be able to explain the general causes of cell injury. Okay, explain the general causes of cell injury. And then finally, we are going to seek to explain some cellular pathological conditions. We have to be able to explain some cellular pathological conditions. As we progress, if there be any question, if I happen to be running faster, please prompt me, okay, so that I am able to, I'll be able to go over whatever you do not understand. You really must get the concept and get it very well, so that when we are advancing, we shall not get ourselves into any tight corner. Okay. So this is what we seek to do. Just as we did in anatomy and physiology on the Monday, we considered the cell theory, okay, and then various types of cells. In pathology, we are going to look at injuries that occurs to the cells, okay, various types, and then we'll be fine. So what are we referring to when we say cellular injury? When we say cellular injury, what are we talking about? We are saying that cell injury refers to the sequence of events that occurs when stresses exceed ability of cells to adapt. Cellular injury would come about when a stressor, something that stresses the cell, okay, it stresses it so much so that the cell's ability to adapt is it goes beyond that, so much so that the cells are unable to contain it. Okay, so cells adapt on the onset of stress, and we are going to look at the various stresses that we are talking about. So when cells adapt on the onset of stress, okay, it does so until the stress ratio exceeds the adaptive mechanism of the cell for a period. Okay, so for example, let me put it in this way. When you happen to find in a snowy environment, here, so we are so thankful to God. But when you happen to find yourself in a snowy environment, decide that you shall undress and then stay, your body will be able to adjust, what we call adaptive mechanism. It will be able to adapt. But when you continue to stay in the soil environment, the cells will begin to die. Okay, so when a stressor, okay, stresses the cell beyond its limits of adaptability, then injury is going to result. Now, sometimes the injuries we talk about, it can be reversible, reversible, and some too are irreversible. Usually, a lot of things can be done to reverse it. Reverse. However, irreversible injury is something you can't do anything about. The cells are eventually going to die. Okay, the cells would eventually die. So that is what cellular injury is all about. Now, let me explain it better using this diagram. This is a normal cell. This is a 3D version. So this is a normal cell. The plasma membrane around it in a cargo stressor or a stress mechanism. It will adapt. Either becomes flattened, it becomes bigger, whatever it becomes. So it adapts. Sometimes a stressor can impact a normal cell, and the cell will go straight into a reversible cell injury. From a normal cell, it goes straight into a reversible cell injury. Or from a go straight into an irreversible cell. Either of this two, the cell would have sometimes to the stress will get the cells to adapt, and the cell was the stressor will adapt to a reversible cell injury. Stress will still be there until the stress overrides the reversible cell injury into, and this is what our bodies usually go through each and every blessed day. At this point, is there any question for me?
Over this diagram.
Okay. Now, we are talking about cell injury. Okay, injuries to the cells. Any on 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 our bodies, any disease condition that we see, uh, even if it is infection, doesn't get the hepatitis B virus to destroy it. Now, if the hepatitis B virus continue to impact on what the the cell that has adapted, it it may get to a stage hepatitis. By this time, you're having hepatitis because it has undergone a reversible cell injury. If it continues to impact the cell, it adapts. It continues to impact on the adapted cell, it goes to reversible injury, or it goes to irreversible cell injury. Sometimes the stressor can be too much in such a way that it hits a normal cell and straight it goes into reversible cell injury. For example, you step into, or you hold a naked wire and it electrocutes your hand. Or sometimes, let me say what, you get hit by something, okay, something, or maybe you are cut with a knife. Yeah, I mean something. So you go straight, it impacts a normal cell, and that cell goes straight into a reversible cell injury. Okay. Sometimes too, the stressor can be too much that it hits and then straight you are going to irreversible cell injury. Okay. So this is how stresses impact our cells. Even though sometimes we can be quantifying, we can be looking at it in the organic level, organ level, or systemic level, or tissue level, but it is within the cellular level as well. Okay, so this is cell injury. A stressor must impact a normal cell. It goes into adaptation. When it impacts the adapted cell, it goes into reversible. When it goes into irreversible, and the cells will die. Sometimes the stressor can be too much on the normal cell. It goes straight into reversible cell injury, or from normal cell straight to irreversible cell injury. I don't know if you are okay up to this point.
So
Yes, please.
Okay.
Yes, sir.
Okay. So now let's move on. Now let's look at causes of cell injuries. Okay, causes of cell injuries. The stresses, what actually causes cell injury. One of the most common ones is oxygen deprivation. Oxygen deprivation. Okay. You know, cells, when they're hypoxic in nature, when cells do not receive oxygen, definitely, whatever it is, they are going to injury. In fact, deprive your brain cells, okay, deprive your brain cells of oxygen for 5 minutes, and you are entering straight into stroke or death, brain death. Once your brain dies, whether your heart can beat for 100 years, still you die because you are in coma. Okay, so one of this one makes cells die frequently is oxygen deprivation. The second thing is chemical agents. Chemical agents, we can name them whether through food, whether through inhalation, whatever it is. Once it goes into your body frequently and your body is unable to detoxify them properly, then it becomes problematic, even including pharmaceuticals. Okay. Then we have infectious agents, infections, viruses, bacteria, fungi. Okay. All of them can serve as stresses. They can cause cell injury. Then we have immunologic reactions. Sometimes your body undergoes an hypersensitivities. There are 4 types. What we usually call um okay, allergy. There are 4 types of hypersensitivities. Type 1, which you call allergy, you know that your immune system is fighting an unknown agent. And once it does that, it can even cause other cells to undergo cellular injury. Sometimes when your immune system is fighting itself, what we call autoimmune diseases or autoimmune disorders, okay, they are all immunologic reactions that can cause diseases. Then we have genetic factors. We have genetic factors, especially when you have DNA issues, okay, DNA or RNA issues. Then you are going to have problem with some cells undergoing injury, okay. Then you have nutritional deficiencies or imbalances. Your body needs some nutrients and they need it in their right order. When they are not getting them, when you are eating one way, they are not getting them, then there is going to be a problem. There's going to be a problem to the cells. Okay. Then we have physical agents. There are physical agents that can impact us. Okay. Physical agents can impact us. A lot of them. Okay. That one too can cause cellular injury. Then aging. Aging too can be a factor that can cause cellular injury. So these are the causes, these are the stresses. Okay, these are some that we have named for our study. Okay. Okay, so let's take them one by one and then see. Oxygen deprivation. There's something called hypoxia. Okay, hypoxia. Hypoxia is one of the most common causes of cell injury. Okay, it causes a loss of ATP production. Just as we talked about yesterday, you know that the body relies on glucose for energy production in the mitochondria of the cell. Now, when this glucose gets in there, by that time they would have been converted into pyruvate. Okay, so when they get into the mitochondria, what happens is that energy production must start, but it must start in the presence of oxygen. Okay, it must start in the presence of oxygen. If your body is deprived of oxygen at that time, you know that the cells would be unable to convert the glucose into energy. Okay, would be unable to convert the glucose into energy. Once it is unable to convert the glucose into energy, those cells will now begin to what? Show signs of stress, show signs of injury. Okay, will show signs of stress, will show signs of injury, and then you know that there's going to be a problem. For example, when your liver begins to show signs of hypoxia, that is when you realize that the person will come and complain to you. When I walk small, then I am tired. When I walk small, then I'm tired. Then you realize that the liver is showing signs of what? Hypoxia. The hepatocytes are beginning to what? Beginning to be deprived of what? Energy. ATP, adenosine triphosphate. Okay, that will power the organs to be able to function to the optimal. Once they are not getting it, the glucose is not turning to ATP, then the organ is going to show signs of what? Reduced function. Okay, if it is about the brain, the person can sleep, cannot concentrate that in anything. Okay, so all these things are factors for us to understand that our bodies are deprived of oxygen. Okay, the bodies are deprived of oxygen. Okay, then so when it is deficient, we usually call it ischemia, and ischemia can cause a lot of this disease condition. In the brain, you are having stroke, because when you deprive your brain of oxygen for some time, it is going to be ischemic. That is why we call it ischemic stroke. If you are lucky, you get stroke. If you are not lucky, you die. Okay, cardiopulmonary failure, when your lungs are not getting the right quantity of oxygen, the right amount of oxygen, you are going to have a failure of your cardiopulmonary system. Okay, your heart is going to what? Become ischemic. They are going to die, what we call myocardial infarction. You're going to die. Okay, especially when there's a blockade in any of the coronary arteries of your heart. When there's a blockade in your coronary arteries of your heart, you are going to get problem. Okay, the arteries that are supplying, because blood is not going, it's the blood that is carrying the oxygen. If it is unable to go, it cannot send oxygen to where it's supposed to get, and for that matter, you are going to suffer ischemic conditions of the heart. Okay. So yes, so usually these are some of the conditions. Normally, these are some of the conditions of that, but I won't go into this. But there's one. Okay, we'll reach there eventually. Yes, Mr. Solomon.
Yes, please. Thank you for the opportunity. Can you please amplify your voice a little bit so that I can hear it well, please?
Oh, okay. Is it like that for everyone? Because I feel I'm really shouting, pal. My voice is low, eh? Listen.
Oh, it's okay. I can hear it loud and clear.
Not to all of us, because some of us are having it very loud and clear.
Then I think Mr. Solomon may be
Okay.
a
It's clear, but I want you to please go over the hypoxia. I want to
Very well.
understand it more. Yes.
Very well.
Okay.
So,
Thank
Mr.
you.
Solomon, can you change yourself a bit so that maybe a network problem, or maybe a settings on your laptop?
Okay, thank you, sir. Thank you,
Oh,
sir.
okay.
I will do that.
Okay. So let's look at the hypoxia.
Yeah, I think he needs to check from the mic, the up there.
Okay. Okay. Yeah. Yeah. So he will do it.
Speaker, so that it will come.
Oh, okay. Don't know, Mr. Joseph, your line is breaking, but I think we get your point. Yeah. So let me repeat the oxygen deprivation. Okay. Now I know we have not done hemodynamics. I know we are just starting. So sometimes it may be something in your eyes. Yeah. So when you study hemodynamics, we have not gotten there, but I realize that the blood circulating in you would eventually get to the pulmonary system, to eventually get to the lungs. Okay. Once it gets to the lungs, it will await the oxygen you are breathing inside. So when the oxygen you are breathing gets into your lungs, the alveoli, and then they exchange. So the carbon dioxide in your blood will now come out, and the oxygen will now enter the blood, and then it will go back to your heart to be taken to all parts of your body. There's a certain quantity of oxygen that must be present at all times in your blood. Okay. To be able to distribute, the blood is the one sending oxygen to all parts of your body. As the Bible will say, the life is in the blood. Okay. So the oxygen is being sent to all parts of your body. Every cell in your body, blood must get there. Okay. To be able to deliver oxygen and take the carbon dioxide. The reason why it is doing so is that in the cells that we talked about, the place in the cell called mitochondrion is where ATP is where energy is being produced, and it does so with the help of oxygen. So without oxygen in the mitochondrion, the glucose that has gotten there cannot be converted into energy. Okay, it cannot be converted into energy to power the cell. Okay, and so the oxygen must now get there. When the oxygen gets there, it goes into the mitochondrion to blend with the glucose to be used to power to be used to convert to energy, and which will power the cell. You get it? Now, in the absence of oxygen, when glucose alone gets into your mitochondrion, it cannot be converted into ATP because it does so with the presence of oxygen. You get it? And so when glucose stays there and is unable to be converted into ATP, then you are going to have the cells being deprived of ATP. Eventually, the ATP, the energy in the cells, are going to deplete because new ones are not coming. Once they deplete, they are used up and they are done. That cell will now become dormant. It will have no energy again to what to power the cell. And for that matter, that cell will now be there without energy. It's like you, the individual, you are starving, you are fasting, you are fasted and I'm starving. Okay, so the cells are no longer going to be powered, and eventually, if it continues like that, the cells are going to adapt. It will get to a reversible cell injury, and then boom, it gets to an irreversible one, and then it dies and goes away. Okay, so it dies and goes away. That is how it is, and that is what happens mostly in our beta cells in the pancreas. Okay, they will die, and once they die, they cannot function to produce insulin, and that, for that matter, you have diabetes. Once it happens like that, you have diabetes because the beta cells of the pancreas are gone. Once they are gone, they are unable to function again. Where is the insulin going to come from? Once the insulin is not going to come, sugar stays in your blood, and you have to go for external. You have to go for insulin from somewhere. Okay, so essentially, oxygen deprivation to any part of the cell, any part of the body, the cell will cause that cell to eventually die. After undergoing a lot of stress, it will cause it to die. And once it dies, it is dead. You can't reverse it. Unless, of course, you are able to rely on stem cells and this one, but it is not simple like that. It's not so simple like that. Okay. So that is what it is. And when a cell is deprived of oxygen for a long time and it adapts and then it dies, that condition, we call it ischemia. Ischemic in nature. It is ischemic because it was deprived of oxygen. I hope you've gotten it now. Okay. Okay. So now let's go to yes. So okay. So let's go. Now let's look at chemical agent. We've looked at one stressor, which is hypoxia or oxygen deprivation. Okay. Another one is chemical agent. Another one is what? Chemical agent. So we have something called hypertonic concentration of salt. Okay. So sometimes, let me even leave this one so that I don't confuse you so much. So let's look at poisons. Okay, poisons like arsenic, like cyanide or mercury. All these things are poisons. The body does not understand them. Once it goes into the body, it is going to get your cells to be in trouble. Okay, they can cause injury to the cell fast, and then problem will start coming. Insecticide and herbicides. Okay, all these things are foreign, unknown to the body, and they are able to impact the cells so badly. Okay, air pollutants, carbon monoxide from exhaust fumes and all of them. Now we say this one, we are industrializing, and industrialization is bringing another problem, and that problem is what? These air pollutants everywhere. Okay, yes, Yes, galamsey. Yes, you know. Yes, thank you. Galamsey. You know, galamsey is bringing in a lot of things, and then we are eventually going to die through galamsey if nothing is done about it. Even if galamsey stops, it will take quite a considerable time to get the soil to be reversed. Okay, so we are in serious trouble as we speak. We are in serious trouble. Occupational hazard like asbestos. You know, asbestos is very, very poisonous. Those who have asbestos as their roofing and they have not done sealing. When the sun hits on asbestos, it is very poisonous, very, very poisonous. I hope you know asbestos. What asbestos is? Okay, I hope we know. Okay, so yeah. Okay, the alcohol the able to produce the ones that are coming from it really throws off balance your liver. It doesn't really get your liver to function properly. Yes, it is true that alcohol play a role in trying to tame glucose, okay, so that um, you are not getting over more glucose in your blood like that. Yes, it is true. It is also true you're likely not going to get diabetes. That's also true. But the how do you call it? The side effects is more than what you think. Okay, because anytime alcohol gets into your body must cease to function. Your liver must cease to function until it is able to break alcohol into non-toxic substances. And once it is doing this, it has left its mandate, it has left its role. And that is what many people think it has been able to lower our sugar. So that is what it is. Okay. So that is for chemical agents. That is for chemical agents. Okay. Is there any question for me on chemical agent before we go to the next agent?
Hello, sir.
Yes, Mr. Men.
Please, for the alcohol, can the one with a low amount causes this cell injury or the high amount, especially the hypertension or whatever? Thank you.
Yes. So that is that. Just one molecule would cause all the cells in your liver to be upstanding until it is able to arrest it and then dechemicalize it or make it less harmful. Okay. So some people will say, oh, this or I mean, in fact, to be very safe, it must have 0% alcohol. Okay, to be very safe, it must have 0% alcohol. Even if you have 1% alcohol, you're going to be up and doing. It may cause direct injury, but your liver will get to a stage that it has to adapt. Okay, if it adapts quite considerable, may injury. So some people would take and all of them 100% alcohol, 90% alcohol, 70% alcohol. It will get to a time your liver would will enter into a reversible cell injury when you have it must have percent alcohol.
Smoke to the to those who don't actually do the smoking. Let's say, for instance, for some of us who don't smoke, and we are living in an area where there are a lot of people smoking. What is the implication? What actually happens? You know, the one who is taking it directly is being affected, but the one who is also not taking it, but indirectly, does it also goes down to affect the cells, and then effect also causes cell injury?
Okay. Yes, so you are right. So physiologically, the air that is Mr. Phillips inside smokers, the air that is getting into you, we usually know it is nitrogen, it is oxygen, and some carbon dioxide. Even though you inhale it, some will pass and then get inside, and all of them. Yes, Mr. Emmanuel is second. So once smoke narcotics, any smoker, even if it is not narcotics, right? It's exhaust fumes, whether it is coming from factories and this one. Once it gets into your airways, it will go all the way into your alveoli. And when it gets there, when the body needs oxygen to exchange for carbon dioxide, it will give it that smoke and take carbon dioxide out, and then it will pass and then go into your bloodstream. And it is not very, very pleasing at all. In fact, it's not very, very pleasing at all. That is how come the government always insists that if you want to smoke, find a place and go and do your own thing. But you know, people will go and stand at your back, but in the wayside, in sometimes near where you stay. And it will be coming into your room. When you go and tell the person, it's going to become fight. Okay, it's not very good. Okay. My network just went off like that. Am I on? Can you hear me?
Yes, sir, we can hear you.
Yes, please, we can hear you.
That's fine. So that is it. So people's perceived negligence. We all must bear. We all must bear the brunt. We all must bear the results. Okay. So that is how it is. So you'll be on the road, and then certain car, the fume that is going to come out. You know, ordinarily cars, the exhaust fumes, the car is able to recycle it so that, but some people will get the problem, and what they are shooting out on the road, and you'll be at the back, driving at their back, or in a public transport, and you inhale. Sometimes the cars cry, you are sitting inside. The smoke that is entering inside, you inhale until you get to your destination. So all these things, we are suffering one way or the other. Yeah, we are suffering one way or the other. So you are right. You are right. Okay, are we okay? Any more questions?
So, sir, please, I have one question.
Okay.
What about self-medication, especially those on painkillers for every time? That one too, how does it cause the cell injury? Thank you.
Okay. You know that okay, so okay, that's fine. We are in an online environment, so I'm just careful of what I say. So painkillers. Painkillers are are not really designed to be painkillers. They are actually designed to be pain blockers. Now let me explain. When you have cell injury in any part of your body, sometimes even when your cells have adapted for quite too long and they are entering into reversible injury, it will send signals to your brain, and your brain would now interpret that as what something is going on. So it becomes a problem called inflammation. We'll talk about that, I think, next week or two. One of the cardinal signs is for pain. So the pain is essentially telling you that there's a problem in any part of your body. However, the signal, the sensory neurons, there are fibers, nerve fibers, the neurons that are sending the signal from the place where the cells are being injured to your brain. The painkiller you are taking will go and then block that signal. Okay, it goes to make the signal dial, and then it stops it eventually. And so your brain will begin to interpret it that once the signal is not coming, then the problem is solved. Okay, then the problem is solved. And if the problem is solved, then I no longer need to send shooting pain. You no longer need to cause pain. But the problem would be there, and your brain would have stopped sending signals. Okay, and that is what happens. Even with the painkillers, I tell you what your liver undergoes, what your liver must go through to make these painkillers less toxic before they release it into your bloodstream. You have no idea. Okay, and that is how come we shouldn't be overly enthused about it. We only must approach painkiller when the pain is so excruciating, when the pain has reached a stage that may cause or may get the patient into a life or death situation. For example, when pain is shooting, it is going up and up and up, and the patient has high blood pressure. Okay, once the pain is going up, the high blood pressure will be going up. In that case, when you employ a painkiller immediately to block the pain so that the high blood pressure can be contained, it makes a lot of sense. But my head is aching me, that a painkiller. My knee is paining me, painkiller. My waist is paining me, painkiller. No, that I don't think that's a wonderful idea. Okay, I don't think that's a wonderful idea. Yeah. I hope you are fine. Can I move to the next?
Yes, please. Do so.
It has worked for them since it contains alcohol and rather supposed to cause damages or damage to the cell and all that.
Yes. So sometimes, last Monday, I was talking to you about herbal medicine, the extraction processes of herbal medicine. Okay. The idea of using alcohol is to extract the metabolites. Okay, is to extract the metabolites. Okay, polyphenols, I mean, all these things are there that are good for our body. But going through boiling, it may destroy some. Okay, so you have to extract it. But most often, after extracting it with alcohol, what you do is that you now go through another process to get the alcohol out and then get your metabolite. But most often in our setting, because alcohol became part of our life, once we extract it with alcohol, then straight into our body. However, the metabolites are going to get their work done. That is no two ways about it. But when you take such a drug for a long time, you are going to have that effect from the alcohol too, which may not be a wonderful idea. But for a short period, you get the metabolite into your body, they are able to work, and then after that, you stay off for your body to regenerate itself, recover itself. Then you may be, it may not be a nice, it may not be a bad idea. Okay, it may not be a bad idea with that process. But when, like a man I know, stop alcohol, says, okay, I will take bitters. I'll go and take I'm just taking my drugs through alcohol. So essentially, you'll be there and then it may not be very fine. Okay. Okay. So, Auntie Gladys, yeah.
Sir, please, most of the aged are also taking it all, and they talk about how good it is for them. So what about them?
The aged, yes. So, we as practitioners, we do not necessarily measure health chronologically, but biologically. What am I saying? Sometimes someone can be 80 years or 70 years. Okay. But when you check his biological markers, it may be better than someone who is even at 30. Okay. Some too, it may be the vice versa. So some people will take that bitters, to do their things. These days, I don't know why all of a sudden these days, drugs that are promoting fornication and sex and everything come for bitters. Use it to stay on the woman 30 minutes, 40 minutes, 1 hour, and all these things are going around. And young men are buying it left, right, center. They don't know they are on their highway to hell. Okay, so these things are abundant these days. However, how genes play out is a wonderful thing. Someone can be at the age of 80, will take alcohol and be fine. The same quantity of alcohol, let a 28-person year take it, and what will happen to that person will not be very, very, very fine. Okay, whatever it is, we as naturopaths, as much as possible, we have to educate our patient, our clients, to stay away from alcohol unless it becomes so necessary, like painkillers we talked about. It becomes so necessary, then we can employ it. Okay, then we can employ it. I hope it's fine.
Thank you, sir. I'm very grateful.
You're welcome.
Hello, sir. My hand is up.
Yes.
Yeah, I did a presentation, and it was a research work I did about safety of the drugs or medicine that we take. And from what our sister said, it is very clear that all those medications that we will be taking are not 100% safe. Be it the herbal or the conventional. Because somebody can be on this diabetic or hypertensive drug for long. And especially the men, they complain of losing their manhood because of being on that drug for long. So it means that the drug will be doing something better in a way, but at the same time causing some harm as well. So we need, as you rightly said, as naturopaths, we need to delve into most of these things and educate our clients, because it is very important that we know this and do it as well. Thank you very much.
Yes, that's true. That's true. You know, forgive me for my bias, but I believe that God, in His wisdom, placed the metabolites. Okay, the secondary metabolite, the primary ones are in our food. The second one is in the plant, the herbs, the buds, the roots. These secondary metabolites, God in His wisdom placed them there and blended them together. So when you want to go and use chromatography to take some of the metabolites away from their primary source, and then you now go and put it into a chemical, and that, and you, I mean, it becomes something else. Why don't we consider its crude form? Okay, and then give to the person. Me, that is what I believe. Okay, so this is what we are having, the challenge we are having in the health industry, but we can understand that it's the business for some individuals, so we take it like that. But I hope we are okay. I am moving
Yes,
on.
please. Yeah, okay.
Okay, no, so after chemical agents, we go to infectious agents. Okay, these infectious agents can injure cells directly or indirectly. It is either it is hitting the cells directly or it is producing toxins, okay, in response to inflammatory response, okay, or trying to get the cells to be destroyed, okay. So these are parasites, fungi, bacteria, it's a form of bacteria, and then viruses, okay. So they can produce toxins. Sometimes they want to protect themselves from death, and for that matter, they produce these toxins. Sometimes, as their natural this one, they will produce the toxins, and these toxins can injure our cells. Okay, or it is either they themselves are directly impacting our cells. Okay, so infectious agents can be part of the causes of cell injury. Then we have immunologic reactions, okay, like anaphylactic reaction, okay, to foreign protein or drug, okay. What is anaphylaxis? Who knows? Who knows what anaphylaxis is? Okay, so that's fine. So I won't show you. I want you to research it later.
Can I try?
Yes, try.
Okay, anaphylaxis has to do with, I think, oxygen exchange. When oxygen is restricted, and sometimes the body goes through certain shocks and regurgitations of the heart. That is anaphylaxis in a nutshell.
Okay. 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 Thanks. You've tried. Yes, Mr. Samuel.
Okay, so what I know is when a life threaten that occurs when someone is allergic to something.
Yes, that's also true. Okay. So sometimes you can go through a shock, anaphylactic shock. And what happens is that your body would be what? Would have encountered something, it feels that it is foreign and begins to fight it. Okay, and begins to fight it. And once that happens, it can get your body, I mean, it can stop your body. I mean, you can't do anything. Okay, and it is even life threatening. It is life threatening. Okay. So sometimes immunologic reactions can destroy our cells. Okay. Immunologic reaction can destroy our cells. Then reactions to endogenous self-antigens, okay, like autoimmune diseases, as I was talking about. You know, arthritis is autoimmune. It's your body fighting against itself, okay? So this is it. So these are your immunoglobulins, okay? These are your immunoglobulins, and they have seen a foreign body, and they are attacking it, okay? And they're attacking it, and once they're attacking it, they realize that they will be forced to what, attach themselves to cells or tissues, and it becomes problematic. The way your body will respond to this is not easy. A typical example is allergic rhinitis, okay, running nose. When something, you inhale something like dust or pat lambda or something, and then your body goes into, give you the money. Grandma give you the money. Okay, welcome. Oh, it's not morning, it's afternoon. Afternoon. Okay, so yes, so these are examples of how our bodies treat how our bodies treat. So like allergic reactions, you know, when you inhale something that your body is allergic to, okay, your body is allergic to, there is an allergic response by the body. And that allergic response happens when your mast cells or basophils, when your mast cell or basophil, you know what basophil is? I don't know exactly what your curriculum for the 6 months was, but so there's a cell that is part of your white blood cell, okay, called basophil. Part of your white blood cell, okay, yes, called basophil. So what they do is that, and the mast cell, what they do is that when you heal something that is allergic, they have something in them called histamine or histamine, okay. They will begin to release the histamine, and the way your nose will do you get runny nose and this one and all of them, okay. Sometimes even viruses, okay, rhinovirus can cause it in our nose, in our nostrils, okay. So they release this histamine, then your nose will do runny nose, and then you'll be sneezing, you'll be doing this. All these things are allergic reaction, and in doing so, you can injure a lot of cells in your airways. Okay, you can injure a lot of cells in your airways. So immunologic responses can do exactly that. Shh. If you talk again, I'll play the biscuit. Play with you. Then we have genetic factors. Okay, genetic factors. There are some genetic factors. No, at this point, immunologic reaction. Is there any question for me? Immunologic reactions. Is there any question for me? Very well. So let's go to genetic factors. Okay. Now, you know that genes can become disruptive. Our genes can become problematic sometimes, maybe during transcription or when it was folding up, it becomes problem. And I give him biscuit to him. Where is your biscuit? Where is your biscuit? Where is your biscuit? Huh? Give his biscuit to him. Okay, so let's go on. Okay, sorry. So congenital malformations. Okay. So Papa was saying, congenital malformations. Okay. So just as we talked about on Monday, in our nucleus, you will see 46 chromosomes or 23 pairs of chromosomes. Sometimes you can have extra. Okay, sometimes you can have extra. For example, if the first pair of chromosomes, you are supposed to see two. Oh, I'm coming. Okay, so sorry. So we have you open the nucleus, and instead of seeing 23 pairs of chromosomes, for maybe the first pair of chromosomes, you may see 3, or second pair may see 3, or the 21 pair see 3. Okay. We usually call that trisomy. Okay. In medical circles, we call them trisomy. So I want someone to do a quick search for Google, okay, and tell us if the 21st pair of chromosome, instead of seeing 2, when you see 3, what does it mean? What disease condition is that? Research it. I'm coming right now. The children are worried. I'm going to lock them up. Great, thank you. Yes, have we been able to get the answer? Yes, Mr. Philip.
Yes, sir. Per little search I did, it says that what happened to the body having an extra chromosomes causes. It says it can lead to abnormal gene dosage, disrupted cell division. It can also lead to developmental delays and organ malformation. That's what. But he explained the trisomy as normal human cells supposed to have 46. So it says it's non-disjunction, that failure of the chromosome to separate properly during meiosis.
That's true. So you can understand why we have some diseases. So for example, when you research the more common ones that we have, trisomy 21, or chromosome number 21 disease condition. Okay. So when instead of having 2, you may have 3, and it results in a condition called Down syndrome. Okay, so these are genetic conditions. I have a medicine for Down syndrome. Get for it. Has anyone been able to treat Down syndrome patient for the patient to become normal person? I mean, has anyone done that before? Maybe, miracles do happen, and research is still on.
Yes. Program.
Oh, I understand. Okay, I understand. I understand what you are getting. That's the epigenetic views. Okay, I understand what you are saying.
Thank you.
Okay. You know, we are in school, and we are supposed to rhyme with science. Okay, so genetic conditions are genetic in nature. It is highly unlikely for you to reverse it. That no two ways about it. However, with epigenetic research these days, you may likely be able to correct. You may likely be able to correct some of the signs so that it matches
Sir,
to.
sir, my hand is up. I also did the research.
Oh, okay.
What I have here is a crucial interconnection. That's the epigenetics. And they are saying there are these health conditions that are prevailing if one is going through that. We have obesity, we have chronic stress, we have inflammation. These are mentioned as the prevailing conditions if one is having the 3 chromosomes. That's regulated metabolism from lifestyle, and then neuroscience from modern stresses, then also the immunity from altered environmental exposures.
Okay.
So it says that interaction fueled by an aging global population and environmental changes creates the complex health landscape we face today. Thank you.
You're welcome. Sister Mercy, you want to speak? Oh, it's a mistake.
No, please. No, please. It's a mistake.
Okay. So yes, genetic conditions would present some phenotypical features. Okay. With epigenetics, you may be able to correct some of the features, but where the problem is coming from, the causative, you can't change it. For example, sickle cell, thalassemia, or sickle cell. Epigenetically, you may be able to try and then correct some of the physical features or even factors that aggravate or exacerbate these conditions. But one thing is certain, they have problem with their beta chain of the hemoglobin. And for that one, I don't know how you can correct it except transplant. Okay, except that the bone marrow is taken and a normal person's bone marrow is fixed. You see, but you may be able to correct some of the this one that comes up, or the factors that impact these things. Okay, these are genetic diseases. In fact, I believe as we are going on, you may really be able to understand what genetics we are talking about. I think it's our next lecture in physiology. You will understand what the genetics we are talking about, and you'll be fine. Any question for me so far? I'm looking at some names. Some people, they have never spoken in my class. I'm going to mention their name. Yeah, Mr. Philip.
Yeah, thank you, sir, for the opportunity. Sir, when I was also looking at the trisomy 21, I also saw what you call trisomy 18 and trisomy 30. The trisomy 18, it says it's Edward syndrome, and the trisomy 13 says it's Patou syndrome. Sir, please, can you throw a little light on it for me?
Yeah, so don't worry at all. We are going to do a lot of genetics when we get there. So you see, genetic conditions, like just as we are saying, even this is even at the chromosomal level. This is at the chromosomal level. We are supposed to have 23 pairs, but one pair can be 3, or sometimes even one pair that is supposed to be there will be missing. Okay, so these are genetic conditions. And so when we are talking about genetic conditions, for example, we go and sit on radio, and then we're talking obesity. I have this drug, I have this one. You have to ascertain whether the obesity is as a result of the human OB gene the person has disruption in, or is even simply coming from the type. So you have to really get to the bottom, because when you make your mind, when you perceive that obesity is simply an eating pattern, it's just that our calories are going more than our energy expenditure, then it becomes problematic. You have not gotten to the root. Okay, so you have to really ascertain. Get inside. Oh yeah, go. I put it there and go. Bye. Okay, so stay there until 6 o'clock. Okay, so so you have to really ascertain, is it coming from the human OB gene? It's not easy. Naturopathy, your head you really think. In fact, for naturopathy, you think it is not that structured. This one, that as if like, what is wrong with you? My head is aching me, the right paracetamol. My stomach is saying, how do you call it? A protein pump. You write protein. Then no. That's not naturopathy. You are seeing in each person individually. Mokometo bako. Okay, so that is how it is. So you have to really understand what is happening to your patient. And that is how come history taking alone. Sometimes you can spend about 45 minutes to 1 hour with your patient alone. For our conventional, this one, sometimes you won't even finish talking. I've written your lab for you already. You are going in 10 minutes time. You have stand up and then you are going to the lab. This is not medicine. This is not medicine. Okay. So you have to really learn well. Okay, so that is how it is. That is how it is. There are a lot of inborn errors as well. For example, someone comes to you and says, "Doctor, if I start my menstruation, it doesn't stop, it doesn't cease until I go and take an injection." Oh, bah! Go and do a scan and come. Oh, then it is fibroid. Fibroid, no, sir. Look, you have to really get your history right. It may be that this person has inborn metabolic errors, a disease condition we call von Willebrand. Von Willebrand appears later in life around 35 years, but it's an inborn error. So the person started menstruation at the age of 13, 14, 15. Didn't see this until she's 35 years. And when she starts menstruation, it doesn't stop. When she starts menstruation, it doesn't stop. It is an inborn error, hemostasis problem, platelet factor 8, 7, or 9. You have to do that. The fact that you see fibroid now, you see, that is how come you have to really take your time and do your history well. Other than that, you are going to be in trouble. Serious. Mr. Gabriel. Or it's a mistake. Mr. Gabriel, your hand is up. Or it's a mistake.
Hello, good evening. Good evening.
Good evening.
Yeah, good evening, sir. Yeah, yes, sir. I have this patient. Anytime she starts menstruating, I think either the hand or she feel pain at her joint, either the hand or the legs, and she can go through this after the menses for even more than after the menses more than a week. She will still get feel that pain, severe pains, and then she can't go anywhere.
Okay. Your line is. Mr. Gabriel, are you done? Or is the line that has?
I want to know what the cause is because we have tried so many doctors. They have tried it. Hello.
Yes.
Hello. My network is not good at all over here. Please, can you hear me?
Yes, please, we can hear.
So I want to find out what exactly the problem is because we've tried so many ways, scan everything, and we are not seeing the problem.
So, yes, so that is why you are in school. So, one of the things that you usually face is that there are certain factors that will aggravate certain disease condition. When a woman is menstruating, definitely, or I'm going too far, this is a pathology too. When a woman is menstruating, definitely you know that some hormones are going to be released. And these hormones must have their target cells. But these hormones are traveling in the bloodstream and they may affect other cells as well. Sometimes the impact is that other cells also respond. Okay, these cells might have been going an original stressor. They may even have gotten to a reversible injury. But because these hormones have not directly impacted them, they are there until they get their impact. Okay, so there's a way we see these cases. Whatever the person is complaining of, you have to be able to rule out other factors. For example, if the person complains of the knee, is it possible you can rule out medial muscular tension, or you can rule out arthritis of the knee, or you can rule out bursitis or meniscal tear, all of them. So the person must do an x-ray of the knee. If it is the way, must do x-ray. The person also, all these things must be ruled out. For all you know, these conditions might be there, but they are just aggravated by that situation, that period, the hormones that are released. Okay, so these are some of the things that would really come up to us to help with. But I think as time goes on, we may get time to really consider these things very well.
Okay, sir. Thank you very much, sir.
You're welcome. Okay. So now let's move. If there be no contribution, so genetic factors can cause a lot of things. Okay, so we have a lot of them, hereditary steatosis, GCSPD, and all of them. So this is an example of normal red blood cell. They are biconcave nature. Okay, so as they go, they pass through our blood vessels. As they go, the blood vessels will become what will separate, and it has to go through. When it is going through, it may squeeze a little. But when it is secured, this abnormal, this one, when it is secured, you know what is going to happen. These sickles will not be able to go through the blood vessels normally. And eventually, all that you need is one to block way, and then all of them will come and stagnate. Okay, all of them will come and stagnate, leading to that very painful, painful experience that they goes through. Okay, either sequestration or aplastic. It's very, very painful because the blood is not going. Okay, so they have to be rushed to the hospital for all of them. So these are some of the things, genetic factors. So in this one, you can do something about this. Okay, you can do something about this. Okay, but it doesn't mean you have cured or you have treated sickle cell. This is where we get it wrong. Okay, I hear people saying they have medicine for asthma. Let's go on. So we have other things like nutritional imbalances. Okay, other stresses like nutritional imbalances. Okay, sometimes you can have protein calorie deficiency. Okay, protein calorie deficiency. You can have vitamin deficiency, anorexia nervosa. Who has said this condition before? Anorexia nervosa and bulimia nervosa. They are twins. They are twins. Anorexia nervosa and bulimia nervosa. You know, there are some people in the So there are some people in this life, it is a psychological problem. For anorexia nervosa, they won't eat because they are afraid they will become fat, obese. So the food cry, they won't eat. You get it? And they will be there, chingling, as if they are going to Miss Ghana or Miss World. Chingling like that. Always underweight. Okay. And this is really problematic. It's once they are not eating, they have nutritional deficiency, and it is problematic. And you know, when you are underweight, it's problem. When you are overweight, it's problem. Okay, so that is that for than anorexia people. And you have bulimia. But bulimia is a little funny. For bulimia, that's the sister of anorexia. For bulimia, they will eat whatever food they want to eat. But when they finish, they will just put their finger in their throat to vomit everything out. Okay, because they think they are going to get fat. So these are some of the nutritional deficiencies that we have. If you have a sister or this one suffering from anorexia, then you know that person is going to be underweight. That person is going to suffer from nutritional deficiencies. Any disease that comes and attacks the person, it may be something else. Okay. Then sometimes we have excesses in lipids like obesity and atherosclerosis as it happens in high blood pressure. And then we have metabolic diseases like diabetes, cholesterolemia, high triglycerides, and all of them. Okay, so these are nutritional imbalances. Any question for me for nutritional imbalance? Any question for me before we move to another thing? Okay, so that's great. It means you understand. When it comes to food, dear, we don't joke with it at all. For food, dear, Africans are always in love with food. So let's go to physical agents. Okay, physical agents. We have mechanical trauma. Doctor, I broke my leg. I broke my hand. I was taking something from my wardrobe, the top, and then the chair I was standing on, I slipped and I fell down. And then these are mechanical trauma. Okay, accident. I was in the car, RTS, road traffic accident. Okay, sleeping. The children pour water on the floor, and I didn't know I slept. And my leg, one was here, and then it turned to something else. Okay, so that is that. We have extreme temperatures as well, like burns, and then frostbite. Okay, like deep cold, this one, frostbite, and then burns. All these things too can cause causative physical agents. Okay, radiation, it happens. It's quite intriguing that you go and take a scan, sorry, an X-ray, CT scan, or plain radiograph, and the radiographer himself or herself, after putting you, they have to leave the room because of radiation and leave you to your feet. It's not easy. So radiation is there, and then electric shock. Okay, and then electric shock. All these are all physical agents. Okay, these are all physical agents that can really cause our cells to die or enter into reversible injury. Is there any question for me up to this point? Okay.
Hello,
Okay.
sir.
So, yes, Mr. Men.
I want to ask one question about wound. When wound is totally healed, then there will be some scars. I mean, over it. So that means they are all dead cells. The scars.
They are all what?
Dead cells.
Okay,
Scars.
that's okay. So we are going to learn scar formation. In our next two lectures, we are going to learn wound healing. Okay, wound healing, and we shall learn scar formation. There. Healing by first or secondary, primary or secondary intent. We are going to do that so that you understand. Yeah. Any more? You're welcome. Yes, Mr. Amevoji.
Thank you, sir. Mine have to do with neuroscience. You were there is this lady I met. She is at the age of 15, and according to the mother, when she gave birth to her, it was through surgery. And per my diagnosis, she's suffering from cerebral palsy, which means at birth she couldn't have oxygen running through the brain cells. And this lady has been at one place for 15 years now. She's not able to walk, she's not able to talk. May I find out from you which of the cells in this case are malfunctioning, or what can we actually do? Yeah, as a matter of fact, when I do research, I'm giving her some products, and now if you intend to look at you, there's a little movement. When I went per the mother's submission for 2 solid months, this lady has not enjoyed anything called sleep. Day and night she'll be weeping, but now she can sleep. At the same time, she was suffering from constipation. She was not able to have free bowel charges. But by God's grace, per the nutraceuticals, she's now okay. But my question is, in such condition, what areas must be focused on? Thank you.
Thank you. Okay. So yes, cerebral palsy, birth asphyxia. Just as you said, the period when the baby had to take the first breath, perhaps prolonged. Okay, and once the baby leaves the mother, oxygen, it is deprived of oxygen. You must take the first air into the lungs so that it will cry. That is what makes them cry. They'll be crying like that when it inhales the first breath. But in cerebral palsy, it is delayed. And once it is delayed, there's going to be problem. The brain is going to go through ischemia, and then it will die. Some part will die. Okay. But I think last 2 years or last 3 years, I came across a research, is it a research or something like that. And conditions like that, if only it is not genetics, conditions that are genetics, they are different. If only it is not genetics, like cerebral palsy, something can be done. The research I came across was as a child, the practitioner started taking care of at the age of 6, and by the age of 12, you could hardly see any trace of cerebral palsy. You could hardly see any
Okay.
trace of cerebral palsy. This I'm talking about was the research, but well, it is 1 in a million. So I have not really taken the time to also get the cerebral palsy patient and then try this same process. But what I know is that per all the documentation that was available, in 6 years' time, the patient came well. There was no trace that you could see that it was a cerebral palsy patient. You know, the brain is such that it can. I mean, for we humans, we are not using. Forgive my word. We are not using all of our brains. Forgive my word. I don't know how to put it better.
But that's you've said it right.
Yeah.
Yes, it's
So,
somebody.
mhm,
They are not using all of our brains.
yeah, because some research says that we only use 15% of our brain. It sounds insulting, but forgive me. They say we only use 15% of our brain, and some are saying we only use 9% of our brain. That is how come even when one hemisphere dies, you can train up another part to take up the role that the hemisphere that is dead was doing. Okay, and that's the strategy we use to manage stroke. Okay, so cerebral palsy, part of the brain is dead. Part of brain died. That part of brain suffer from hypoxia, and for that matter, the brain part of it is there, but you can train other part of the body brain to take up the responsibility for what the part that is dead was to have done. Okay, that is what I know. So much of your focus should be on um, 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 nutraceuticals that it really enhances brain function, like ginkgo and all of them. Okay, and I believe that by and by the child will be fine. Yeah, yeah.
Thank you very much, sir.
You're welcome. You're welcome, Mr. Emmanuel.
Thank you, da. And good evening, sir.
Good evening.
Sir, when we were doing the cells, the causes of the cells, you made us understood that when we drink alcohol,
Yeah.
sometimes it affects our heart.
Yeah.
And I had a friend, he can drink alcohol and he'll be breaking down for more than over 2 weeks, not even eat, he will not and he will forget everything. So that I just want to know what's the causes of that.
Yeah. So just as I was saying, genetics play a role. Genetics in the sense that what your body would be able to quickly adapt to or adjust, another person wouldn't be able to do so. I remember when we were infants, when we were young, when I was around 10 or 12 years, that time in our village, we used to have palm wine tappers, plenty of them. And so one day we went to the bush to go and catch to go and catch our crabs. You know, we'll go and do change from the streams and then catch our crabs and then we'll come and roast and eat. When we're coming, we passed by a palm wine papa and he gave us wine, palm wine. Believe you me that all of us who drank the wine, the same couple, what I went through when we came home, only God knows. And I understand my grandmother had to go and get some leaves, come and macerate and then give it to me before I was able to. But all my siblings were okay. So it depends on how your body genetically is able to withstand something. Okay, something your body will be able to withstand for 1 hour. Someone's body may be able to withstand for 2 hours, someone 6 hours, someone the 30 minutes. Okay, that is how we all are. We are different. Okay, so with your friend, that this one he took, 2 weeks breaking down. Yes, someone will even go 1 year. Someone will die instantly. Someone will even not go 1 day. Okay, so that is how different we all are. But one thing is certain: what is happening to your friend is that a reversible injury occurred. For your friend to be able to stand up with no body, with no trace of this one, means it was reversible. The body has been able to regain itself. But if he had gone to irreversible, then it may be disastrous. So that is essentially what is happening. Okay, that's essentially what is happening.
Yes, thank you. But one lady asked a question that now we have these herbal medicines, and some of them will say that you need to add a little alcohol to it, and some of them say that you should even mix with alcohol and the rest. So that one too, it affects our heart, or it does it affect our brains?
Yes, alcohol is alcohol. Alcohol is alcohol. The only thing is that, just as I was saying, when you are taking it with a herbal preparation, when you have extracted the metabolites are going to work or are going to function on their own. And the alcohol too is going to cause what it will cause. But if the injury, okay, if the body must first adapt, if the body is able to adapt well enough until you are able to done with the medication that you use alcohol for, you are okay. If the body enters into a reversible injury, then you know that the signs are going to come up and tell you that no, this medication is not good for you. You have to stop. But if your body is able to adapt until you are able to finish, then you are okay, you are good to go. Even though it is not advised, then you are good to go. But for some people, straight away, you are going to get into reversible injury. And your body will tell you that this medication, you can't continue.
Okay. So that, please, finally, what about those who are selling those energy drinks?
Yeah.
Is it good?
Energy drinks?
Is it good for our health?
Energy drinks, in and of itself, is problematic. In fact, thank you that you put it into energy drinks, because we are not mentioning any brand. It is even possible that the student I'm teaching, someone owns an energy drink factory or is working, the father owns for this one. So we are just talking about, please, we are just talking about general, okay, general information. So energy drinks does not have any impact, positive impact on your body. Nothing, essentially. All
so
that.
So those with the aphrodisiacs.
Aphrodisiacs.
Yes.
And so as for them, they will die early.
Okay.
So if you want to, the best thing is that the way God has designed the body, is good. We are learning the way God has designed the body. All that you need to do is to remove an impediment or help the body to actually do the work it is supposed to do. You are not supposed to introduce a substance that is going to do that work that the body must do for you. No. That should not be your goal. Or you should not, I mean, you should not cause your body to do what, if we are going, assuming you are going for are we inside? Close it. If imagine you are going for 100 meters, okay, 100 meters, or if you are going to play ball, I'm not sure that as soon as you wake up from bed now you go to the field. That would be wrong. You have to go and do some warm-ups. You start slow, you get on board until you get to a stage that you are able to enter the field and play. But for aphrodisiacs, what it does to our body, it's not good though. It will just ginger your body, and don't worry. You and if you focus so much on that, then you and death, you are eating from one plate. That is what.
Okay, because that this Sunday, a lady came to me in our church, and said that when she started menstruation, she can even menstruate for 5 days, but now just only 1 or 2, and it ceased. And he has been to hospital, but they cannot even really tell her what is happening to her. So she came to me for prayers because I'm a pastor, I'm a bishop, and I said, well, today when we come to class, I'll just ask you that, please, what's the causes of that? Because you can just menstruate only just 1, and next day the menstruation ceases. So I just want to know, because he said that he's coming for prayers because he has been to hospital and they are not able to find any remedy for her. So she thought that prayers can even heal her. So I pray with her, but I just want to know.
So that, yes. Okay, fine. Yeah.
She's just 20 years old. Yes, just 20 years. Yeah, just 20 years. Thank you.
I want to help a little bit here with ladies who are having that sort of menstrual cycles. First thing you do is to check her hemoglobin level. If she's anemic, constantly the menses will be slowing down, because during the menstrual period a lot of blood flows. So if hemoglobin is below 10, she cannot have a proper menses and still be correct, because the normal one is to about 11.5. That is very good. But some have about 9 point something, and she's always going with it, which means that she's not eating properly. The other side is that I had a young lady who is working. Fortunately, she's even a virgin, for about getting to 35 and so on. But she was taking some products to boost her nails to grow nicely and her hair to grow nicely. She did that in for about a year or two. Then she realized that her menses are now coming twice every month and very heavy. She was going to do masters and she's supposed to go through all this health thing. Then at the hospital, the doctors found out that she has got something that changed her hormones. So they gave her some medication, and within 2 or 3 months later, it started becoming once a month. So most of the ladies, something she has done would have done what is happening to her, even though she's 20 years. You must ask her a lot of questions. The sort of things she eats and drinks and her lifestyle. And then you check her hemoglobin level and see if she's anemic, you boost it up, and then she can become okay. Thank you.
Thank you.
Okay. I don't know if you want to add more. Sister Eunice.
Good afternoon, everyone.
Good afternoon.
Speaking on the diagram you have on the screen, say if a patient is diabetic and had chronic infection with the wound, can that lead to gangrene?
Forgive me. Can you come again? I'm sure you are asking a question.
Yes, I said. I'm asking pertaining to the picture on the screen.
Okay.
Or for the ulcer. I'm saying if a patient is diabetic and have an inflammation for a long period of time, if that can lead to gangrene based on the type of ulcer the person is having.
Okay. Yes, for diabetes, that is one of the classical how do you call it? One of the things that diabetes can lead to. Okay, so it is highly possible. It's highly possible. Although what the picture on it is an electrocution, it is still possible that gangrene can set in. Okay.
Okay, thanks.
Yeah. Mr. Mevoji, your hand is up, or is the earlier one? Okay, so that's fine. Yes. So that is that. Good. So that is that. So a lot can happen. A lot can happen. You know, the difficult part of medicine is to be able to diagnose and diagnose well. That's the only difficult part. But other than that, once you're able to know what is wrong with your patient, you are done. Okay, so now let's move on. Aging. Okay, so individuals age because their cells age. Okay, so once we are aging, a lot of things will be changing. I'm not giving that one of the assignments is on aging. So I will be meeting you very soon on that. So let's now go to the factors that affect cell injury. Factors that affect cell injury. Factors that affect cell injury. One, we have type, we have duration and severity of injury. Okay, the type, duration, and severity of the injury. Then we also have the type of injured tissue, its adaptability and genetic makeup. What we were saying. Okay. There's problem everywhere. The clothes from school. Problem everywhere. Okay. So just as we were saying, depending on the tissue type or the cell type, okay, depending on its genetic makeup and its adaptability, okay. For example, brain tissue, close it and close it. Brain tissue, okay, can survive for up to 5 minutes when you deprive it of oxygen. Okay, it can survive up to 5 minutes. The heart muscle can survive up to 2 hours. Skeletal muscle can survive up to 6 hours. Okay, so these are some of the things. So depending on the tissue or the cell that we are talking about, then you know that its genetic makeup or its period of adaptability is at this rate. Okay, so that is it. Now, important target of cell injury. Okay, important target of cell injury. Now, when cells injure, so if cells injure, you are going to have problem with what? Depletion of ATP or decreased synthesis. Either ATP is depleted or it is not even being produced. Okay, so because just as I explained, when oxygen is not going to the cell, when you are seriously hypoxic, it becomes problem for ATP production. Then we have what? The problem for cell membranes, mitochondrial lysosome, and other organelles. Yes, so that is it. Protein synthesis. Proteins are unable to synthesize properly. We'll go to that. You understand what that thing means. You have problem with genetic apparatus, cytoskeleton, and all that. Okay, so when cells injure, these are important targets of the body. And these are the basic level. Once you understand, when you pick up a disease condition at its lowest level, you understand what is happening. What is happening at the lowest level, at the cellular level. Okay. Yes, so this is an example. So when there's a mitochondrial damage, you have a decrease in ATP production. Okay, decrease in ATP production. And then you have an increase in reactive oxygen species. Okay, increase in reactive oxygen species, or what you call free radicals. Okay, which will destroy the cells eventually when antioxidants are inadequate or are not many in the cells. Okay. So sometimes you can have an influx of what? Calcium, okay, in the cell. You can have an influx of calcium in the cell, which will lead to mitochondrial permeability. And you know that there's trouble coming. When there's mitochondrial permeability, there's trouble coming. Okay, or activation of multiple cellular enzymes. So you can recall that some of the antihypertensives, so some are calcium blockers. So I want someone to do research and then tell me some of the calcium blockers and calcium Antihypertensive, that are calcium blockers. Okay, antihypertensive, that are calcium blockers. And tell me some of the medications so that you understand what they do. Who has got it? Yes, conventional ones. Yes, exactly. So when you are prescribing amlodipine for your patient, you know it is a calcium blocker. Okay, and the reason is simple. When there's an influx of calcium in the cell of the heart, okay, in the myocardium, it will cause the heart to beat very, very fast, leading to exacerbated forms of what? Hypertension. So they introduce amlodipine to block calcium influx. Okay, so these are some of the brain behind the why they are designed. Okay, so sometimes you have membrane damage as well. So plasma membrane damage leads to what? Loss of cellular component, and then lysosomal membrane, enzymatic digestion. So once the membrane is damaged, there is going to be an influx of what? A lot of this one, and the cells will not be able to survive. It will die. It will die. Then sometimes you have protein misfolding. Protein misfolding. Okay, protein misfolding can lead to a lot of what? Genetic conditions. Okay, so there's a research work that was done by some group of people. They are called the Human Genome Project. Human Genome Project, and they came out with the research that humans have approximately 25 to 27,000 genes. 25 to 27,000 genes. So you take one cell, just one cell that you can't even see with your naked eye. The genes that are there are between 25 and 27,000, and they all have their respective what they are doing. All of them have their respective work they are doing. So that is it. So at this point, any question before we go on? Any question for me before we go on? Mr. Champo, you want to ask a question? It's like you are unmuted. Okay.
Oh, sorry.
Okay, great. So now let's look at the mechanism of cell injury. Okay, mechanism of cell injury. Now it begins with mitochondrial damage. Not always, but when mitochondrial is damaged, you are going to have reduction in oxidative phosphorylation. Okay, what is oxidative phosphorylation? It's one of the steps in the production of what? ATP. Okay, in the production of ATP. Okay, so when you have a reduction in oxidative phosphorylation, then you are going to have a buildup of reactive oxygen species, ROS, reactive oxygen species. These are free radicals, and these things can damage the cell in no time. They can damage the cell in no time. That is how come in the wisdom of God, he designed antioxidant like catalase, like glutathione, like superoxide dismutase, and all of them, so that they can counteract the work of the reactive oxygen species. Okay. So this is it. So reduced oxygen supply to mitochondria will lead to a reduction in ATP production, increasing reactive oxygen species, leading to multiple cellular abnormalities and necrosis or cell death. Okay. So yes, so for this one, it dies naturally. Apoptosis is a programmed cell death. So it is programmed to die that time. Then that you know that cell is on its way to Awudome. The cell is gone, going to Awudome to be buried. Okay. So let's see, mitochondrial damage. We are saying that free radicals have a single unpaired electron in the outer orbit. Should I really concentrate on this? Okay, so yes, so some of the free radicals are reactive oxygen species. You have superoxide, you have hydroxyl radicals, and then hydrogen peroxide. All of them are part of what the free radicals. Okay, and usually you have vitamin E as antioxidants, vitamin C, very powerful antioxidant, catalyst, superoxide dismutase, glutathione. Okay, all these are there for us to peruse in our fight against free radicals. Okay, when it is produced in excess, they react with and damage proteins, lipid, carbohydrate, nucleic acid, and all of them. Okay, these diverse molecules may themselves be reactive species with a chain reaction being set up with this. So yes, so what all that we are talking about is that the cells have buildup of free radicals, superoxide, hydroxyl radicals, reactive oxygen species, and hydrogen peroxide. All of them are there. But we have something to counteract them. The one the body produces, the one we find in what our food substances like vitamin E and C. But glutatase, glutathione, catalase, glutathione peroxidase, and then superoxide dismutase are all antioxidants that we can rely on to counteract their effects. Okay. So this is it. This is the mitochondrion. You have radiation, toxins, reperfusion. So entering there. Then you have production of ROS. Okay. So you have superoxide in here. You have hydrogen peroxide, and you have hydroxyl radicals. Okay. This will lead to conversion to hydrogen peroxide by superoxide dismutase. This superoxide, okay, superoxide dismutase will convert it to hydrogen peroxide, and then it will eventually be done away with by glutathione. Okay, so this is hydrogen peroxide. Okay, so it will lead to decomposition by glutathione peroxidase or catalase. Okay, so and then it becomes less harmful to the body. Okay, so it is either superoxide dismutase comes through hydrogen peroxide, and the hydrogen peroxide will now decompose to will now decompose by the use of what catalase and all of them. But pathologic effects, if they are not counteracted, you know that it is going to lead to lipid peroxidation, which will lead to membrane damage. Okay, sometimes you can have protein modification, DNA damage. Okay, so that is that about mechanism that leads to cell injury. Are we seeing stars? Am I getting you more confused? Let me see. There are people here. They have never spoken. They are just here. Let me just go and mention names.
Please, but you will be giving us the slides to study.
Yes.
Right? Okay. Then we will be confused more.
Okay. Okay. So let's try as much as possible to do. You know what we are doing is basic anatomy and physiology. We have not entered into the advanced. We are just doing basic anatomy and physiology. So try to read, so that you'll be fine. Okay. When we are done with when mitochondrion is damaged, let's go to when cell membrane is damaged or plasma membrane is damaged. Okay. When cell membrane is damaged, it leads to a reduction in the sodium pump. Okay. It leads to a reduction in the sodium pump. Okay. We'll talk about this in the, I think, lecture 7, sodium potassium pump, when you're talking about action potential. Okay. So how substances move in the cell and out of the cell is reduced. Okay, it's reduced. because cell membrane is the cover, is the wall, is the one making sure that nothing enters by chance. It must enter for a purpose, and something must leave out of the cell for a purpose. Okay. Then we have sodium and water enter the cell, and then potassium exits. They exit. So sodium and water, sodium, which is more outside of the cell, now begins to influx the cell, and then potassium leaves, and then leaving it in a negatively charged mode, which may blare up the cell. It may kill the cell. Okay, it may kill the cell when it happens like that. So it says endoplasmic reticulum dilates, the cell swells and bleeds up. Okay, just as I was talking about. Once there's more sodium going in the cell, then there's problem. Okay. Then we have aerobic glycolysis, okay, or glycolysis occurs with the loss of glycogen, accumulation of lactic acid. Okay. Let me skip this so that, because many people have started seeing stars already. Okay. Okay, so this is the design. Cell membrane damage. This is the design. There must be an injury somewhere, and then this injurious agent is now here as the calcium getting into this. It grew to what? Increased cytosolic calcium, and then eventually these processes occurs. Okay, so yeah, the chain reaction begins, and then the problem cells becomes or faces problems. Then we have DNA and protein damage. DNA and protein damage, when you have misfolded proteins, lead to unfolded protein response. Okay, so we have misfolded proteins. We'll do protein synthesis, but you just read this. When you get to protein synthesis, you will understand, okay, how proteins are formed. Or even with that, you may come back to this slide and then read and understand it better. Okay, so that is that. Now let's look at okay. Before that, is there any question for me before we look at our final part of this slide? Is there any question for me? Okay. Okay. So characteristics of reversible cell injury. Okay. Characteristics of reversible cell injury. Injuries to the cell that are reversible. Let's see what they are. They say we have decreased synthesis of ATP by oxidative phosphorylation. Okay. We have decreased function of sodium potassium ATPase membrane pumps. Okay. So sodium potassium pump. There's a decreased function in there. Okay. And then it in turn causes an influx of sodium and water, influx of potassium, cellular swelling. Okay, all these things happen during a reversible cell injury. We say the switch to glycolysis, which results in depletion of cytoplasmic glycogen, increased lactic acid production, and decreased intracellular pH. Okay, and then we have decreased protein synthesis, which leads to detachment of ribosome from the rough endoplasmic reticulum. Read this so that when we are going, you begin to understand what it is. Okay. Then you have plasma membrane blaring up, and the myelin figures the scene. So yes, all these things happen within a reversible cell injury. That one you can reverse it. But the one you cannot reverse, this is what happens. You have severe membrane damage, playing a critical role in reversible injury. It allows a massive influx of calcium into the cell and allows influx of intracellular enzymes and proteins into the circulation. Okay, so enzymes that are supposed to be kept within the cell, because there's an influx of calcium into the cell, it forces them to get out of the cell, and then they are dumped into circulation. And then the signs and symptoms becomes apparent. Okay. We have marked mitochondrial dysfunction, producing mitochondrial swelling, large density seen within the mitochondrial matrix, irreparable damage of the oxidative phosphorylation pathway, and an inability to produce ATP, adenosine triphosphates. Okay, so with irreversible cell injury, the mitochondrium is gone. It cannot even produce ATP. Okay. Then lastly, you can have rupture of the lysosomes, which causes release of lysosomal digestive enzymes into the cytosol and activation of actin hydrolysis, followed by autolysis, cell death. Okay. The cells, they die itself. Okay. So this is what happens in irreversible cell injury. Okay. When and many conditions, many conditions, okay, you find this happening in there, and you know that when it comes like that, you know that the cells have gone beyond repair. They have gone beyond repair, and no matter how hard you try, some way, somehow, somewhere, the patient may die. Okay, the patient may die, some way, somehow. Okay. So this is it. This is it. At this point, my slide is saying we are done. Any question for me? From what we have done so far today, any question?
Hello, sir.
Yes.
Yeah, please, not a question, but I want to find out whether you can document some books for us to buy and read, apart from the slides and other materials the school is giving.
Okay. Recommend some books. Okay, I'll try and see. I'll try and see if I can